A traditional healer in my language, which is Zulu, is a sangoma, right? Which literally means one who comes with song. A traditional healer is somebody who is able to live in duality between the physical realm and the spiritual realm, and is able to channel spiritual energy from the spiritual realm into the physical realm, and is also able to communicate with spiritual energies and ancestors. My name is Dr. Christie. I am a traditional healer. My ancestral name is Gogo Bazamile, and I'm currently the indigenous healthcare advisor at the University of Cape Town. My service here is to be able to provide culturally appropriate mental health support and indigenous healthcare support for students who use traditional medicine as a primary healthcare model. The World Health Organization started in 2018 saying that traditional medicine needs to be incorporated in Western medicine as primary healthcare models. Why? People in South Africa, 80% majority of South Africa use traditional and indigenous medicine and healthcare. The notion has been that people go to traditional healers because they struggle to access Western medical intervention, right? When what we are trying to say is, for some people, it's not because there's a struggle to access, but because it's their primary healthcare model. They believe in ancestral veneration, they believe in indigenous medicine, they believe in African spirituality. Young people will come to me if they have cultural concerns, if they have spiritual gifts, and if they have ancestral callings. So what I would do is offer them psycho-spiritual counseling and advice on how to navigate managing spiritual and ancestral energy in their bodies. Because of the fact that we struggled with passing down indigenous knowledge because of the Witchcraft Act of 1957, colonizing us and demonizing our African spiritual practices. It means that we've had gaps where there's certain generations that were not able to accept the calling of traditional healing within certain lineages. So what happens is these people have now completely turned their backs on ancestral veneration.
We wanted to explore what students' experiences are in terms of indigenous health and how that impacts their academic journey at the university. We are probably one of the first universities in the country who have incorporated the indigenous health as part of our westernized practice within the student wellness.
What Western medicine is trying to do is, how do we expand our practice into transcultural psychology, transcultural psychiatry, cross-cultural psychology? How do we expand that practice to make room for cultural differences? Because at the moment, according to the Department of Health, referring to a traditional healer is referring down. It's not referring across. So we are not considered equal as primary healthcare practitioners. Most of the spiritual power is carried by women. Most of the people who were healers, most of the people who carried indigenous medicine were women. So there was a patriarchal element of it, and then there was also a very religious dogmatic element of it that demonized African spirituality. Now I'm lucky because I'm privileged enough to be able to follow my ancestral call.